Welcome to the Module 1 Biopsies. Biopsies are vital medical procedures that involve with the removal and examination of tissue samples from the body to diagnose various diseases or conditions. By analyzing these samples under a microscope and through advanced imaging techniques, healthcare professionals can make accurate assessment, enabling them to tailor appropriate treatment plan for the patients. The word biopsy is a Greek terminology and it is derived from two words bios, which means life, and opsis, it means vision. So basically, biopsy is vision of life. A biopsy consists of obtainment of the tissue from living organism, whereas autopsy is obtainment of the tissue from a dead organism. So here we take this tissue and for the purpose of examining it under the microscope in order to establish a diagnosis for the sample. Biopsy has a history that can be traced back to ancient civilization where rudimentary forms of tissue examination were performed. However, it wasn't until 19th and 20th century that biopsy saw significant advancement and systematic development. During the 19th century, pivotal breakthrough such as invention of compound microscope by Anthony von Leeuwenhoek and refinement of histological staining techniques by pioneers like Rudolf Virchow contributed immensely in the understanding of cellular pathology. This led to the foundation of modern biopsy practice, enabling microscopic examination of tissue to identify various diseases. The term biopsy was first introduced in the medical terminology in 1879 by Ernest Besnier. However, the first diagnostic biopsy was performed in Russia way back in 1875 by M. Rudinev. As the field of pathology progressed, notable figures such as Carl Theiss, Julius Conim, and James Ewing played instrumental roles in establishing the use of biopsy for diagnosing different ailments, especially cancer. These early pathologists pioneered the sampling of tissues for diagnostic purpose, laying the groundwork for biopsy techniques used today. The development of advanced biopsy techniques in the early 20th century, including fine needle aspiration and core needle biopsies, marked a significant leap forward in terms of diagnostic accuracy and patient comfort. These techniques allowed for extraction of tissue samples with minimal invasiveness, reducing patient discomfort while improving the precision of diagnosis. Next, in the contemporary medicine, guided biopsies using state of art imaging techniques such as ultrasound, computer tomography, and even magnetic resonance imaging have become a standard practice. These techniques enable healthcare professionals to perform targeted and precise biopsy, facilitating accurate diagnosis and personalized treatment plans for patients. After immunohistochemistry and genomic medicine, the third revolution that is knocking at the door of pathology is artificial intelligence. AI based diagnostic platforms perform image analysis for tissue histology, analyze molecular outputs to integrate with clinical characteristics to predict prognosis. So, what is the aim of doing biopsies? Biopsies are done to provide a representative sample for the pathologist to interpret while minimizing postoperative discomfort for the patient. Next, we will learn what are the key reasons why oral biopsies are important in dentistry. 1. To confirm a clinical suspicion and to arrive at a definitive diagnosis. It is also used for treatment planning, for management of potentially malignant disorders, for early detection of cancers and monitoring progress in certain conditions, and for research and education and also for patient assurance. So we'll come to the first key important factor, confirming clinical suspicion and to arrive at a definitive diagnosis. We all know that if there is when a clinician is in doubt, he can definitely go for biopsy, and biopsies provide an objective confirmation for what the clinician has thought in his mind. Different oral pathologies have similar clinical appearances, and because of which the clinicians may be in a confused state of mind wherein he is not able to arrive at a diagnosis. So, biopsies definitely help in arriving at a final diagnosis. Biopsies definitely help in planning your treatment. Different pathological conditions or different oral conditions have different approaches in treating. For example, a radicular cyst has to be enucleated, whereas a huge odontogenic keratocyst has to be marsupialized. So it depends on the diagnosis which a pathologist provides to you on, and because of which your treatment planning may differ. In the management of oral cancers, it is always said that earlier the lesions are picked up, the better it is for the treatment. So, diagnosing a potentially malignant disorder is usually done by providing biopsy at an early stage, and timely intervention of oral cancers can be made. In many cases, as we can see here, the point where you take the biopsy is very important, and it definitely influences the report of the biopsy. Biopsies in a regular interval period are required for tracking changes in the tissues, which can guide in ongoing management. For example, in lichen planus or even in submucous fibrosis. So biopsies are usually done to help in research because they contribute for the ongoing research for the understanding of oral disease and their management, thereby benefiting the future patients. Biopsies are also important for patient assurance, as they offer reassurance by providing clear diagnosis and guiding appropriate treatment. Knowing the nature of their condition can relieve the patients of their anxiety and facilitate informed decision. Now, let us know the indications of oral biopsies. Any lesions which are persistent for more than 2 weeks without any proper etiology has to be biopsied. An inflammatory lesion that is not responding to any local treatment even after 10 to 14 days, even after removing the local irritant, has to be biopsied. A long-standing hyperkeratotic surface lesion has to be biopsied. A persistent swelling, either visible or palpable beneath a relatively normal tissue, has to be biopsied, and inflammatory changes of unknown cause that persist for a long lesion or a long period has to be biopsied. Lesions that interfere with local function, for example, occlusion, for example, a fibroma at the occlusion plane causing interference in the occlusion, has to be biopsied. A bone lesion with no superficial identifying feature, only you can see it with the radiographic finding, can be biopsied, or any lesion that has characteristics of malignancy like erythroplakia, ulceration, or if it is persistent for more than 2 weeks, the growth is very rapid, then there is bleeding, which can cause bleeding with even gentle manipulation, an indurated lesion, which is hard or firm when you touch compared to the surrounding, or a lesion which is fixed to the underlying structures or adjacent structures are also an ideal choice for it to be biopsied. Biopsies are also used to determine the lesion which do not readily respond to conservative and simple therapy. They are also used to establish diagnosis when there is a suspicion of neoplasia. They are used to determine nature of all abnormal tissue removed from the oral cavity, including cyst and granuloma. Now, let us know what are the contraindications for performing a biopsy. The biopsy procedure has no absolute contraindications, although there are certain relative contraindications which we are supposed to know. Any lesion which is a normal anatomic or racial variation, such as physiologic pigmentation, leukoedema, linea alba, tori, exostosis, should not be biopsied. A biopsy is usually contraindicated when there is a compromised generalized general health of the patient and the history of diathesis, including patient with anticoagulant therapy, are usually avoided for biopsies. Biopsies are also avoided when the lesion is very in close proximity to vital structures like vascular area or a neural vessel or a ductal structure, and also not performed when the areas are difficult to access surgically. So, when to perform biopsies? Initially, you detect the lesion, then you have health history, complete history, a clinical examination, radiograph, and after that you make a differential diagnosis. With the differential diagnosis, you see for whether it's a non-surgical treatment required for 10 to 14 days. Then if there is improvement, you just follow up the patient. If there is no improvement, then you make a decision for a biopsy. Again, for a non-surgical treatment, if unnecessary or high degree of suspicion is there, then you go for a decision of biopsy. Once you determine it is to be biopsied, then you go to determine the difficulty of the biopsy procedure, whether you perform by yourself or you refer to an oral surgeon or any specialist. Then lesions which do not require further treatment are usually excised completely, and lesions which require further treatment and are evaluated for the difficulty, and then whether you go for yourself or you can ask any other surgeon or a specialist to perform this biopsy. And finally, you do a patient follow-up. So to summarize, what are the steps to follow? First is a patient health history, then history of the specific lesion, then a clinical examination, followed by radiographic examination. Then you do for your laboratory hematological tests and other tests, and finally you perform the biopsy procedure. So what are the general principles of biopsies? You have an update patient clinical record, patient education and consent, and then you go for laboratory investigations, and measures to be taken before biopsies are to be known, and then tissue handling, fixation and transportation, which we will be covering in next modules. Will be learning about it, and these are the basic principles of biopsy. Finally, to summarize this first module, we know that biopsies play a pivotal role in the practice of dentistry. Next, they provide the foundation for accurate diagnosis, informed treatment decision, help in early detection of oral cancer, and contribute to ongoing research and education in the field. Next, without biopsies, the diagnosis and management of various oral pathologies would be considerably more challenging and less precise. So these are the further readings for wherein you can enhance your knowledge, and thank you for being the part of this module.